Many people believe that physical activity is beneficial regardless of when it occurs, as long as some movement is performed each day. Walking in the morning, in the afternoon, or after dinner is often treated as interchangeable, with timing viewed as a matter of personal preference rather than biology. This belief is understandable, but it may be incomplete. After a meal, the human body enters a highly active metabolic phase. Blood glucose levels begin to rise as carbohydrates are digested and absorbed. Hormonal systems respond rapidly to manage this change, directing glucose toward tissues that can either use it immediately or store it for later. During this period, the body is not passive. It is actively regulating fuel distribution, vascular function, and cellular energy balance. What is often overlooked is that movement during this post-meal window may interact with these processes differently than movement performed at other times of the day. Emerging research suggests that the same activity, such as a short walk, can produce distinct metabolic effects depending on whether it occurs before eating or shortly afterward. These differences are not related to motivation or willpower, but to how muscles, hormones, and blood glucose interact in real time. This raises an important question that is rarely discussed outside clinical or research settings. Is all walking metabolically equivalent, or does timing meaningfully influence how the body handles glucose and energy after meals? Understanding this distinction does not require advanced medical knowledge, but it does require a clearer view of what is happening inside the body during everyday routines that most people never think twice about. In public health messaging, walking is widely promoted as a universally beneficial activity. Many guidelines emphasize total daily steps or total minutes of movement, reinforcing the idea that any movement is good movement. While this message has clear value for increasing physical activity at a population level, it can unintentionally obscure important physiological details. One common misconception is that the body responds to physical activity in the same way regardless of timing. In everyday conversations, walking before meals and walking after meals are often treated as equivalent choices, differentiated only by convenience or personal habit. This assumption persists partly because most health education focuses on long-term outcomes, such as weight control or cardiovascular fitness, rather than short-term metabolic processes that occur within hours of eating. Another source of confusion is the traditional belief that physical activity immediately after eating may interfere with digestion or cause discomfort. As a result, many people are advised to rest after meals and delay movement until digestion is complete. This advice, while well-intentioned, is largely based on anecdotal experience rather than controlled physiological evidence, and it does not distinguish between light activity and strenuous exercise. Media coverage and wellness content can further complicate the issue. Simplified messages about fat burning, insulin spikes, or blood sugar crashes are often presented without adequate context, leading people to associate post-meal glucose changes only with diabetes rather than with normal metabolic regulation in the general population. This framing can make the topic seem either irrelevant to healthy individuals or unnecessarily alarming. As a result, many people remain unaware that the post-meal period represents a distinct metabolic state, one in which muscles, hormones, and blood vessels respond differently than they do during fasting or prolonged rest. Without understanding this context, it becomes difficult to evaluate why timing of movement might matter, not as a lifestyle trend, but as a reflection of basic human physiology. Scientific interest in post-meal physical activity has increased as researchers have examined how everyday behaviors influence short-term glucose regulation and long-term metabolic health. A substantial body of evidence confirms that blood glucose levels normally rise after eating, particularly following meals containing carbohydrates. This process, known as postprandial glucose elevation, occurs in both healthy individuals and those with metabolic disorders. Data from large observational studies show that repeated elevations in post-meal blood glucose are associated with markers of vascular stress and inflammation, even in people without diagnosed diabetes. Public health institutions, such as the World Health Organization and the Centers for Disease Control and Prevention, recognize postprandial glucose control as an important contributor to overall cardiometabolic risk, although it is not routinely emphasized in general fitness guidance. Controlled clinical trials have demonstrated that light to moderate physical activity performed after meals can reduce postprandial glucose levels compared with remaining sedentary. For example, randomized crossover studies published in peer-reviewed journals, including Diabetes Care and Sports Medicine, have shown that short bouts of walking after meals lower average blood glucose concentrations over the subsequent 2 to 3 hours. These findings have been observed in healthy adults, older populations, and individuals with impaired glucose tolerance. More recent research has focused on the timing of post-meal activity. A study published in 2025 in Scientific Reports examined glucose responses under different walking conditions following carbohydrate intake. Participants who engaged in a brief walk immediately after eating demonstrated lower peak glucose levels and reduced overall glucose exposure compared with those who delayed walking. This finding reflects short-term metabolic regulation rather than long-term disease outcomes. The authors emphasize that these results describe acute physiological responses and do not, by themselves, predict individual health outcomes. In contrast, research on physical activity performed in a fasted state has consistently shown higher rates of fat oxidation during exercise. A meta-analysis published in the British Journal of Nutrition reported that aerobic exercise before food intake leads to greater reliance on fat as an energy source compared with exercise performed after eating. These studies, however, primarily assess fuel utilization during activity rather than post-meal glucose control. It is important to note the limitations of this evidence. Many studies involve small sample sizes, short observation periods, and controlled laboratory conditions. While the findings are consistent across multiple trials, they describe physiological trends at the population level. Health organizations emphasize that such data inform general guidance, but do not replace individualized clinical assessment. To understand why the timing of walking may influence blood glucose regulation, it is necessary to examine how the body manages energy at the cellular and system level after food intake. Following a meal, carbohydrates are broken down into glucose, which enters the bloodstream through the small intestine. This rise in circulating glucose is a normal physiological process and serves as a primary energy signal to multiple organs. The pancreas responds by releasing insulin, a hormone that facilitates glucose uptake into insulin-sensitive tissues, such as skeletal muscle, adipose tissue, and the liver. Under resting conditions, skeletal muscle uptake of glucose is relatively limited because muscle cells do not require large amounts of immediate energy. As a result, glucose remains in circulation longer, leading to higher postprandial glucose concentrations. Skeletal muscle, however, possesses a second insulin-independent mechanism for glucose uptake. When muscles contract during physical activity, they activate intracellular signaling pathways that promote glucose transport directly into muscle cells. One of the key regulators of this process is AMP-activated protein kinase, AMPK, an enzyme that functions as a cellular energy sensor. When muscle fibers contract, AMPK activity increases, signaling that energy demand has risen. Activation of AMPK triggers the movement of glucose transporter type 4, GLUT4, proteins from intracellular storage sites to the surface of muscle cells. Once positioned on the cell membrane, GLUT4 transporters allow glucose to enter muscle cells without requiring additional insulin signaling. This mechanism is well documented in experimental and clinical research and operates in both healthy individuals and those with insulin resistance. When walking occurs shortly after eating, these contraction-driven pathways become active at the same time that glucose is entering the bloodstream. This temporal overlap allows circulating glucose to be redirected into active muscle tissue more efficiently, reducing the magnitude and duration of postprandial glucose elevation. Importantly, this process does not suppress insulin release, but complements it, lowering the overall insulin demand required to manage the meal. In contrast, when physical activity is delayed until well after a meal, blood glucose levels may have already reached their peak. Although later exercise still promotes glucose uptake, it occurs after the initial metabolic stress has taken place. The physiological benefit remains, but the opportunity to moderate the early post-meal glucose rise is diminished. Fasted walking involves a different metabolic context. In the absence of recent food intake, circulating insulin levels are low, and hepatic glycogen stores may be partially depleted. Under these conditions, the body increases reliance on fatty acids as a primary fuel source. Hormonal signals such as glucagon and catecholamines promote the release of stored fat, which muscles can oxidize during activity. This enhances metabolic flexibility, but does not directly address postprandial glucose handling, as no recent glucose influx is occurring. Digestive physiology also plays a role. Light walking does not significantly divert blood flow away from the gastrointestinal tract. Instead, gentle movement can support normal intestinal motility through stimulation of smooth muscle contractions, facilitating the orderly progression of digestion. This distinguishes light post-meal activity from vigorous exercise, which can temporarily impair digestion due to competing circulatory demands. Taken together, these mechanisms explain why identical physical activity can produce different metabolic effects depending on timing. The observed differences arise not from motivation or intensity, but from alignment between muscle activity and nutrient availability within the body's regulatory systems. Short-term metabolic responses, such as post-meal blood glucose changes, become clinically meaningful when they occur repeatedly over months and years. While a single glucose elevation after a meal is a normal physiological event, patterns of frequent and exaggerated postprandial glucose excursions have been associated with long-term cardiometabolic risk in population studies. Large epidemiological studies indicate that higher average post-meal glucose levels are associated with increased markers of vascular dysfunction and low-grade inflammation. These processes are relevant because blood vessels are repeatedly exposed to fluctuating glucose concentrations throughout the day. Over time, this exposure may contribute to endothelial stress, which plays a role in the development of cardiovascular disease. Importantly, these associations have been observed even in individuals who do not meet diagnostic criteria for diabetes. Glycated hemoglobin, HbA1c, a marker reflecting average blood glucose over approximately 3 months, is widely used in clinical practice to assess metabolic health. Research shows that HbA1c levels are influenced not only by fasting glucose, but also by postprandial glucose patterns. As a result, behaviors that modestly reduce post-meal glucose elevations may contribute to improved long-term glycemic profiles at the population level. This relationship is probabilistic rather than deterministic. Lower HbA1c is associated with reduced risk, not guaranteed prevention, of chronic disease. From a functional perspective, improved glucose regulation may support sustained energy levels and reduce post-meal fatigue, which can influence daily activity patterns over time. Maintaining consistent energy availability is relevant to physical function, particularly in older adults, where declines in activity are linked to loss of muscle mass and reduced independence. There is also growing interest in the relationship between metabolic regulation and cognitive health. Observational studies suggest that long-term glucose dysregulation is associated with increased risk of cognitive impairment. While causal pathways remain under investigation, maintaining stable metabolic responses is considered a supportive factor for overall brain health. Taken together, current evidence suggests that small repeatable behaviors influencing post-meal glucose handling may contribute to broader health trajectories. These effects operate through cumulative risk modification rather than immediate or guaranteed outcomes. Major public health organizations consistently emphasize regular physical activity as a foundational component of metabolic and cardiovascular health. Institutions such as the World Health Organization, the Centers for Disease Control and Prevention, and the National Institutes of Health recommend accumulating moderate physical activity throughout the day, with walking identified as an accessible and sustainable option for most adults. There is strong professional consensus that reducing prolonged sedentary time improves metabolic markers, including glucose regulation. Clinical guidelines increasingly recognize that breaking up sitting time with light movement can positively influence postprandial glucose responses. This position is supported by evidence from randomized controlled trials and systematic reviews examining light to moderate activity in daily life settings. Regarding timing, expert consensus is more nuanced. While there is agreement that post-meal activity can improve short-term glucose control, health organizations have not yet issued prescriptive recommendations specifying exact timing or duration of walking after meals for the general population. This reflects the current state of evidence, which demonstrates consistent acute benefits but remains limited in long-term outcome data. Professional organizations such as the American Diabetes Association acknowledge that postprandial physical activity can be particularly beneficial for individuals with impaired glucose tolerance or diabetes when integrated safely into overall care plans. These statements emphasize individualized application and clinical oversight rather than universal prescriptions. Areas of ongoing scientific discussion include optimal intensity, duration, and frequency of post-meal activity across different age groups and health conditions. Researchers are also examining how factors such as meal composition, baseline fitness, and medication use may modify individual responses. Importantly, there is insufficient evidence to support claims that any single timing strategy guarantees disease prevention. Consensus guidance frames post-meal walking as a potentially supportive behavior within a broader lifestyle context that includes balanced nutrition, adequate sleep, stress management, and regular medical care. In summary, expert guidance supports light movement after meals as a reasonable, low-risk practice, while continuing to emphasize flexibility, personalization, and evidence-based caution. From a public health perspective, the goal of translating scientific evidence into daily life is not to prescribe rigid behaviors, but to offer general principles that support healthier patterns at the population level. Light movement after meals fits within this framework as a low-risk, broadly accessible behavior that can complement existing physical activity recommendations. Public health agencies emphasize that small amounts of movement accumulated throughout the day can contribute meaningfully to metabolic health. Within this context, short periods of gentle walking after meals may be viewed as one practical way to reduce prolonged sedentary time, particularly during periods when blood glucose levels are naturally rising. This approach aligns with broader guidance encouraging people to interrupt sitting with light activity rather than remaining inactive for extended periods. Importantly, this behavior does not require structured exercise sessions, specialized equipment, or changes in diet. Walking can occur indoors or outdoors at a comfortable pace and within an individual's existing routine. From a population standpoint, the simplicity of this approach may support long-term adherence more effectively than more demanding interventions. Public health guidance also emphasizes boundaries. Light post-meal movement is not a substitute for medical treatment, nor is it intended to manage diagnosed conditions independently. Individuals with chronic illness, mobility limitations, or metabolic disorders are encouraged to discuss activity timing with qualified healthcare professionals to ensure safety and appropriateness. More broadly, post-meal walking should be understood as one component of an overall lifestyle pattern that includes balanced nutrition, regular physical activity across the week, adequate sleep, and routine preventive care. When framed this way, the practice reflects a general principle of working with the body's natural physiological rhythms rather than attempting to override them.